There are a lot of myths in Europe, different countries, and I think it's important to to restore these misperceptions by good science, and that was exactly the topic of this symposium.
When you drink less than 1 day per week, independent of the dose, you have a relative risk of 1 by definition. But if you increase the number of days that you drink, let's say 1 to 2 consumption days, the risk is lower, and the risk is even considerably more lower when you drink 3 or 4 days per week.
Beer actually for many years was known as liquid bread, and the reason for that was that it is quite nutritious in a very simple sense in terms of its calorific, mineral and vitamin content.
Light to moderate drinkers should be aware of the potential benefit of their moderation in drinking. They have a protective effect against cardiovascular disease and total mortality. Abstiners should not be obliged to drink, of course, but they should know about the effect of moderate drinking on their cardiovascular disease and total mortality.
You know, everybody is using that expression, beer belly, but if you look at the scientific substantiation for it, it's not there.
Please remember I'm talking about beer in moderation or alcohol in moderation. It's a potential major source of dietary silicon. Silicon makes bone, alcohol prevents you losing bone.
Non-alcohol beer may be a good supplement for lactating mothers. It may improve antioxidant properties of their milk, her own oxidative status and that of their offspring.
The beer contains polyphenols and other healthy stuff. So if you think that the benefits came from ethanol, all the alcoholic beverage may have a benefit effect in moderate consumption.
In general, my feeling is that for adults, during the life cycle, for many aspects, not only health but also social well-being, there is a lot of opportunity, but also a lot of education to be done for beer in relation to health.
My conclusion would be run as much as you can, or walk, if possible with friends, enjoy with friends, and enjoy a good beer, and overall be happy. Thank you very much for your attention.
One of the myths that I've addressed is that beer consumption would be less well than wine consumption, or less healthy than wine consumption. And I've shown that it doesn't really matter whether you drink beer or wine.
With a moderate beer consumption, there's no real association between beer intake and waist circumference or the abdominal fatness or the beer belly.
Beer is in moderation, it's healthy, it's enjoyable, it's a sociable drink.
It's important to realize that beer fits into a healthy lifestyle. And if you combine drinking moderate amounts of beer with non-smoking, with a healthy diet and sufficient physical activity, then I think the European citizen would do the best for his or her health and also for the quality of life.